like to welcome all of you to our seventh in our series, Resilient MD. I think probably one of the best. I've been really excited about this one. Burnout has been obviously something on all of our minds, and that's why this series has been so important. It will be paused for the next 2 months, and we'll be back in September. But the timeliness of this particular talk is unbelievable. I was at the American College of Physicians meetings last month. There were studies presented on meditation. We've known for decades that depression, now with volumetric MRI, shrinks the brain. Mindfulness and meditation does the opposite. There are increases in neurons in broad area 9 and 10. And I know that Dr. Shapiro will be addressing some of this. She has a fabulous TED Talk that if you haven't seen it, see it. And she has a wonderful website also. And you will also be receiving the book as part of your attendance at this meeting. Just a reminder, June 28th, there'll be a social at the Santa Clara County Medical Association that you're all invited. And there'll be more information emerging. So with that, I'd like to turn things over to Roxanne Almas, co-medical director.
Thank you, Jerry Calloway. Can you hear me, Jerry?
Yes.
Awesome. I am so excited for tonight, everyone. You are in for a treat. We have Dr. Shauna Shapiro, who is here tonight. She's a best-selling author, clinical psychologist, an internationally renowned expert in mindfulness and self-compassion. She's a professor at Santa Clara University and has published over 150 papers and 3 critically acclaimed books translated into 16 languages. Dr. Shapiro has presented her research to the King of Thailand, the Danish government, Bhutan's Gross National Happiness Summit, and the World Council for Psychotherapy, as well as to Fortune 100 companies, including Google, Cisco Systems, and LinkedIn. Her work has been featured in the JAMA, Wall Street Journal, Mashable, Wired, USA Today, Dr. Oz, the Huffington Post, and the American Psychologist. Dr. Shapiro is a summa cum laude graduate of Duke University and fellow of the Mind and Life Institute, co-founded by the Dalai Lama himself. Her TEDx talk, The Power of Mindfulness, which is incredible, has been viewed over 2.5 million times. I'm so excited to present Dr. Shapiro for tonight. Dr. Shapiro, it's all yours.
Thank you so much. Sorry about that. I lost my little mute arrow. Try to be courteous and be on mute, and then you mute yourself. So anyway, thank you for that beautiful introduction. And I feel really honored to be here. I was speaking with Aaron and Roxanne before the talk, and especially when they first invited me. And I was reminiscing that my very first research study, which was back in 1998, it was published. So it's back in 1996 that we did it, was with medical students and seeing if I could shift their levels of burnout and help increase their compassion and their empathy and decrease their stress levels. And that study was so effective. The results were so significant compared to a control group that we went on to publish 6 other research studies with physicians, with nurses, with psychologists, healthcare professionals. So I've been in this field of teaching mindfulness to physicians for a long time. And I feel really privileged and honored to be doing it. I feel that you all do the most important work in the world of healing. And oftentimes there's not a lot of support or care for the healers themselves. So I'm really offering this presentation this evening, both as an educational tool and but also just as a personal kind of restoration. And so I hope you receive it as such. So I want to just take a moment and I want to just dive right into the research and the benefits of mindfulness. I'm going to explain what mindfulness is in a bit. And I think for many people, they hear the word mindfulness and it's become so popular, it doesn't really even have any meaning anymore. So the first thing I want to do is say, I will explain it, but I want to start with the research because for me, the research is so compelling that even for people that are kind of on the fence or skeptical or not sure they want to do this, once we review these decades of research, it's it's pretty motivational. So in terms of health benefits, research over the past four decades shows that mindfulness practice, and I'll describe later what that is, but it increases our immune system, it decreases stress, it lowers cortisol, it helps us sleep better. This was actually based on research we did at Stanford a few years ago in the insomnia clinic. And what we found is that mindfulness combined with cognitive behavior treatment for insomnia, sleep hygiene, stimulus control, was more effective than either treatment alone. And we've gone on to publish 6 studies on the impact of mindfulness and sleep. So I'll be talking more about that. It's also been shown to increase our telomerase, and our telomeres are the little caps at the end of our DNA that are really our best, physiological marker of aging. And what the research shows is that people who practice mindfulness, there's an increase of the enzyme telomerase, which is what lengthens our telomeres. So all of this to say there's these pretty significant health benefits and across kind of a wide spectrum of impact. There's also significant cognitive benefits. Mindfulness has been shown to increase our focus and attention. I've been speaking for about 2 minutes, and some of you may have noticed that your mind has already wandered. So focus and attention are very, very important for us to train. It increases our memory, our creativity, our ability to kind of think systemically and flexibly, and it increases our innovation. In fact, we published a study in Harvard Business Review 3 years ago showing that mindfulness increased creativity, innovation, and problem solving in engineers. You can imagine Silicon Valley was very excited about that. In the workplace, mindfulness has been shown to decrease turnover, reduce sick days, increase productivity, increase loyalty, increase job satisfaction, and I think really particularly for this audience, it's been shown to reduce burnout. And I do want to focus a lot on that this evening. These are some of the corporations that have integrated mindfulness into their practices in weekly, daily, monthly practices. And then lastly, and I think most important from a research lens, this is the area that I'm doing most of my work in right now, is mindfulness has been shown to increase compassion. It's been shown to increase compassion for other people and also for ourselves. It's been shown to increase ethical decision-making. And it's been shown to reduce cultural, racial, and gender biases. So what I'm hoping you're hearing from all of this is mindfulness is a powerful tool. And the reason that it cuts across so many different domains is because this tool is really about training our mind. And so it's like we're training the filter, the lens through which we interact with and experience and understand everything. So the word mindfulness means to see clearly. So all we're doing, right? It's not about relaxation. It's not about all these, spiritual kind of mystical realizations. It's literally about seeing clearly what's happening in the present moment so that we can respond effectively. So moment by moment, I'm meeting the truth of what is, whatever's arising, not based on my conditioning, not based on automatic pilot, not based on kind of only partially attending to something and not seeing the whole picture. I'm fully present, I'm seeing it clearly, and I'm responding effectively. I also want to clarify one thing, that mindfulness is much bigger than meditation. So I'll try to be clear in when I'm teaching this, what I'm talking about. So mindfulness is a way of being. Mindfulness is a way of living, experiencing, being present moment by moment. Meditation is kind of the practice or exercise that you do to strengthen your mindfulness. So I like to think of this as kind of like a form of mental fitness, right? We all understand physical fitness, and I would say there's consensus now that it's good for you, and we want to make our bodies more physically fit. There's kind of a new wave that's recognizing mental fitness as equally important, that we can make our minds more flexible and stronger and creative, just like we can create more flexibility and strength in our bodies. And so meditation is just one of the exercises to do this. So mindfulness has 3 key elements, and I want to talk about each of these because they're very important. As I mentioned before, mindfulness has become so popular that it's kind of gotten a little bit distilled, like a little bit watered down, and it loses its transformational essence if we don't understand the nuances of it. So my colleagues and I developed this model of mindfulness that has these 3 key elements, and I want to talk about each one. The first is our intention. And our intention is simply knowing, why am I paying attention? What's important? Because if you think about it, we're bombarded with choices about where to put our attention. And so our intention helps us zero in. It says, this is the most important thing. It really helps us set the compass of our heart. It says, this is the direction I want to head. And so a couple of more things about intention. First is, intentions are psychological. They can even be spiritual, right? What is most important in my life? They're also neurochemical. When you set an intention, what happens is it triggers this whole cascade of neurochemicals, which begin with dopamine, which dopamine is kind of the neuromodulator of motivation, right? So you think, okay, right now it's really important for me to learn. I want to learn these skills so I can feel more peace, so I can be less burnt out. I really care about this. All of a sudden, when you say that, it releases dopamine, which increases your motivation. And then, interestingly, dopamine shifts into acetylcholine and norepinephrine. And these are the neurochemicals of attention, which is our second element of mindfulness. To learn anything, to understand anything, to experience anything, we have to be able to pay attention. So again, now I've been speaking for 10 minutes. How many people have noticed that your mind has wandered again? You don't even have to raise your hand. I already know. In fact, if for some reason your mind has not wandered, send me a note because I want to bring you into the laboratory and study your brain, because you are the anomaly. Research from Harvard shows the mind wanders on average 47% of the time. So that's about half of your life that you're not here, that you're missing. And where does the mind go, right? It gets swept into the future. What am I going to do when this happens? How am I going to handle this? Or we get lost in the past. If only I had done that. I wish I had done this. And what happens is we miss the present moment. And this is really the only moment we have. It's the only moment you have to connect with someone. It's the only moment you have to listen, to learn, to heal, to grow. Now, I want to be very clear. It doesn't mean that we never reflect on the past or prepare for the future. Of course we do. The difference is that we do it intentionally in the present moment. We're not hijacked by the future or hijacked by the past. It's conscious, it's intentional. And that's really the beauty of mindfulness, is that it brings everything into this clear focus, right? If you don't have a stable focus, you get a fuzzy picture. So we're trying to make everything clear. So we bring our attention, you can try it with me right now, into the present moment, and we focus on what's important. What is key about attention is that it can be trained. And if you think about it, this is really our most valuable resource. Excuse me. A lot of people say that time or money is our most valuable resource. It's your attention. If you're not present, nothing else matters. The final element of mindfulness is our attitude. And this has to do with how we're paying attention. Okay, so our intention is why we pay attention. Our attitude is how are we paying attention. And our attitude really has to do with this kind of sense of curiosity and kindness. And I want to talk to you about why this is so important, because this part of it sounds a little bit soft, and I think people kind of, are like, oh yeah, that's a nice side note or something nice to have, but it's not essential. And so I want to give you a little bit of background for why this is so important. So, as some of you know who've watched my TED Talk, I was introduced to mindfulness at my lowest point. I had had spinal fusion surgery. So I had a metal rod put in my spine when I was about 17 years old. I had scoliosis, and the curvature was so significant that if left untreated, it was going to puncture my lungs. So kind of overnight, we had to operate. And I went from being this healthy, active captain of the volleyball team to lying in a hospital bed, unable to walk. And during those many months of rehabilitation, I was in a hospital bed for about 6 months. And the physical pain was difficult. I remember it vividly. It was very painful. There's a lot of rehab. But the mental anguish is what really got me. This kind of fear of the future, that I would never walk normally again, that I would never be happy again, that I would never play volleyball again, which I didn't. So it's not that these fears were all made up, but they were taking over my entire life. And I was introduced to mindfulness during that time. And it was as if there was kind of this path forward, like there was hope that I could be happy again. And so I started reading about it and then kind of practicing on my own. And once I had recovered enough, a couple of years later, I went to Thailand to a monastery to explore mindfulness a bit more because it had been so helpful. And so I got to the monastery, and I knew a bit about mindfulness, but I'd never really meditated, and I didn't speak any Thai, and the monks spoke a little broken English, and they kind of explained to me that meditation and mindfulness were about paying attention, and that we cultivated this attention through the practice, the exercise of meditation. And the way we did this is by just feeling our breath going in and out of our nose. So you guys try it with me, see if you can begin to notice your breath at your nostrils. And so I began, right? 1 breath, 2 breaths, and my mind would wander. I'd bring it back and it would wander again. And no matter how hard I tried, I just couldn't stay present. And this was frustrating because, I thought meditation was going to look something like this, like I was going to be at peace and blissed out and one with everything. And instead, it felt more like this, right? Like my mind was exploding. And these thoughts were really, they felt like they were out of my control. Like I couldn't do it. And so what did I do? I started trying harder, right? That's what we do. We push harder when we're not doing something well. And no matter how hard I tried, I just couldn't get this mind to stay put. And so then what I did is I started judging myself. What's wrong with you? You're terrible at this. Why are you even here? You're a fake. And you may kind of know what I'm talking about. When we make a mistake or we do something wrong or we're not as good as we had wanted, we tend to judge ourselves pretty harshly. Luckily, a monk arrived who spoke English. And as I shared with him my struggles, he looked at me and he said, "Oh dear, you're not practicing mindfulness. You're practicing judgment, impatience, frustration." And then he said 5 words I'll never forget. What you practice grows stronger. What you practice grows stronger. We know this now with neuroplasticity. Our repeated thoughts, behaviors, they shape our brain. So if I'm meditating with judgment, I'm just growing these neural pathways of judgment. He helped me understand that mindfulness isn't just about paying attention or being present. It's about how you pay attention. It's with this attitude of kindness. And so when I came back from Thailand, I'll tell you a little bit more. So as I started practicing in this way with this attitude of kindness, I really had some shifts occur that were pretty profound. And I remember at the end of the retreat, it was a 2-week silent retreat, there was this peace and comfort that I hadn't felt, and specifically a comfort in my body. And it was something that since the surgery, I literally hadn't experienced. And it was so impactful that when I came back, I was decided I wanted to get my PhD and I wanted to study this and understand it scientifically and see if I could teach it to others. So I came back, I got my PhD in clinical psychology. And as I shared, I started working with physicians and medical students. And then I worked at the cancer center with women with breast cancer. And then I worked in the insomnia clinic. And then I started working with high-level executives and stressed out moms and, lots of different people from all walks of life. And what was so fascinating is that everyone I worked with would talk about the exact same thing. This tremendous sense of self-judgment. I'm not good enough. I'm not doing it right. There's something wrong with me, right? Whether it was a parent feeling like they weren't a good enough parent, whether it was a business executive, whoever it was. And it reminded me of my experience in Thailand, that just sense of like constant self-judgment and what the monk had said. So I started studying shame. Like, what happens when you judge and shame yourself? Like, does it make you a better mother or father? Does it make you more successful or productive? And what I discovered is that shame doesn't work. It doesn't help us. It doesn't move us in the direction we want to go, at least not in the long term. So when we experience shame, and this is both shaming ourselves, but also receiving shame from others, and that's a whole nother talk, but very important in education and parenting, especially in the medical education. But when we experience shame, it literally shuts down the learning centers of the brain. It shuttles all of our resources to survival pathways. So when we make a mistake or we do something we're not proud of and we shame ourselves, we actually lock ourselves into that behavior. We close down the possibility of learning how to do it differently. One of my favorite quotes from Brene Brown, she says, shame corrodes the very part of us that believes we're capable of change. Right? And we know as healthcare professionals that the number one predictor of change is whether or not you believe you can, whether or not you believe it's possible. Shame locks that down. So what's the alternative? And here we go. We're back to this attitude of kindness. And I want to be very clear. Kindness does not mean you let yourself off the hook, right? A lot of times when I talk about kindness or self-compassion, people roll their eyes and they're like, you don't really understand. I actually want to change. And I'm like, I get it. And this is the most effective path towards lasting change. That when we treat ourselves with kindness and curiosity, it actually releases dopamine, which we talked about before, which is the neuromodulator of motivation, of learning, right? And we release oxytocin, which creates this sense of safety. So we create this like perfect learning environment if we want to learn a new behavior, a new skill. If we want to do things differently, it's a compassionate mindset, not shame, that allows us to do so. Okay, so I want to, and as we're going along, by the way, please just put any questions or comments in the chat section. And when I get to the end, we'll spend some time with them. But I want you to just kind of feel like you can write in as we go. You don't have to remember everything. So I want to tell you a story about mindfulness in action and about these three key elements, right? We have intention, attention, and attitude. So this is a story, this is a story that it's really quite impactful. Every time I tell it, it's amazing to me thinking back of how big and small these shifts are, how kind of subtle is significant. And there was a high-ranking military official who was having a lot of anger management, and he got mandated to a mindfulness program for anger management. And as you can imagine, he wasn't very happy when he arrived there, but he actually knew that his anger was a problem and he was dedicated to getting it under control. And so after about 3 or 4 weeks, he came back and told the story. He said he was at the grocery store, we have a cart full of groceries, and he was just about to get into the checkout lane when this elderly woman with a young baby girl kind of stepped in front of him. And he started getting really mad because she kind of cut, and he was about to, say something when he remembered his intention to calm his anger. He took a breath, brought his attention in the present moment, brought an attitude of kindness and compassion, and just let her go. So then this woman and the young checkout clerk start kind of cooing and awing over the baby girl. And all of a sudden, the woman hands the checkout clerk the baby girl for a hug. And he is like, oh my God, are you kidding? He almost explodes in anger. He's like, what is this, a nursery? Like, what are they doing? Luckily, he remembered his intention to manage his anger, and he didn't explode, and he took another deep breath and another one. And as he started to calm down, he noticed the little girl was pretty cute. An instant later, she was back in the arms of the woman. They walk out the store. And as the young checkout clerk is ringing him up, he says to her, that little girl was pretty cute. And she looks up and she says, really? Thank you. That's my daughter. And then she says, my husband died a few months ago and I had to go back to work. So my mom brings my daughter through my lane every day for a hug. So you can feel in that moment how everything changes and how grateful he was that he hadn't reacted, that he had been able to regulate his emotions and control his anger and to see clearly. So this is really the power of mindfulness, is this ability to meet the present moment, even a seemingly insignificant moment at the grocery store or in a line, and have this pause between the stimulus, the trigger, and your response. This mindful pause that allows us to choose our response. So I want to take a moment and just invite you to close your eyes and just first notice any emotions or responses to that story, creating space in your body for it, feeling your breath. And that inviting in your intention to be present, and your intention for why you're here, what's important. So maybe it is to help soothe some of the feelings of exhaustion or burnout. Maybe it's out of curiosity or to learn. Maybe it's to find more joy or meaning in your life. So just kind of finding for you what's most important. And then gathering your attention here in the present moment, feeling your breath. And I want you to see if you can just relax the body 5% more. We can't force relaxation, but we can invite it. So see if you can lean your attention a little bit back and a little bit down. Right? We're usually leaning forward into the future, so back and down, and then just let the body rest. Letting your awareness rest here in the present moment where you are. And then bringing in this attitude of kindness. And I know for many of us, this attitude of kindness feels a little foreign. Like, what does that really mean to bring kindness to this moment? But for me, it's helpful just to put my hand on my heart and just to feel that sense of connection, that sense of self-care. Maybe even see if you can feel your own heart beating. The heart is sending oxygen and nutrients to every cell in your body right now, so the heart's taking care of you. And then just thinking of someone that you love, that you care about. It could be someone who's deceased. It could be a pet, puppy dog. It could be a grandchild. It could be really anyone that just when you bring them to mind, you feel this sense of joy. You feel a smile. Notice how that feels. Maybe there's a warmth in the body. And then see if you can bring that same care and that same kindness back to yourself. Taking another breath in and out. So we're practicing our intention, our attention, and our attitude. This is mindfulness. Intentionally paying attention with kindness and curiosity to whatever's here. If your mind's wandering, you notice that, no judgment. You just gently bring the mind back and begin again. That's the key to this practice. You can begin again in any moment. It's never too late. You've never messed up too much. You just begin again. Relax the body, feel the breath, begin again. Training the mind. Growing this mental fitness. Taking another breath in and out. And I just want you to rest here for 3 breaths. And then slowly, gently, I want you to reflect on your intention again, why you're here. Let it motivate you. And then you can let your eyes open. You can go ahead and just stretch your arms above your head if that feels good. I don't have any research behind that, but I know it's good for you. Okay, good job. So that is the formal meditative practice. And as I said before, we do that just like we go to the gym and work out. It's really just to train this ability to pay attention with intention and attitude. So the goal, though, is not just to become like a good meditator. The goal is to bring this intention, attention, and attitude into everything we do, right? Because that's mindfulness. Mindfulness is this moment to moment, seamless continuity of awareness. And so I was reflecting today in preparing to speak with you, what are some of the different ways that we as physicians or helping professionals can bring this intention, attention, attitude model into our work? And I'm going to offer just a few suggestions, and then we're going to talk about the power of practice. But for me as a clinician, the most important thing before I start my day is really to gather my intention, to remind myself of why I'm doing what I'm doing, right? And even if it's as simple as, may this time be a benefit, right? May it help in some way. Not that I always know how, or not that I always can make it happen perfectly, but really that kind of purity of heart and of dedication. And then throughout the day to kind of reconnect with my intention, to ask myself, where is my attention? And then what is the attitude that I'm bringing to this moment? And so what I found in working with different companies and different hospitals with different students is that we can do this at the beginning of class, right? In the middle of class, at the end of class. We can do this at the beginning of a board meeting. We can do this before giving a talk. We can do this before seeing each patient. That this intention, attention, attitude only takes 30 seconds to reflect on, but all of a sudden we're back. And mindfulness is really about kind of remembering. It's about remembering to be present, remembering who we truly are, remembering what we truly care about. And to remember, we have to practice. It's like you can have insight. Insight doesn't really translate into learning, okay? To actually engage neuroplasticity, to actually learn, we have to practice. We need repeated practice. So I want to talk to you a bit about the power of practice. As you all know, as recently as the 1990s, we thought that the brain was static, that it was fixed. It was called the doctrine of the unchanging brain, that we couldn't change. And then there was this miraculous discovery of neuroplasticity, which truthfully, I think is the most hopeful scientific discovery in the last 400 years of brain science. Because basically what it says is that for the most part, no matter what's happened to you, no matter what your past, no matter what your current circumstances, all of us have the capacity to change. All of us have the capacity to literally re-architect the very structure of our brain. Now, I want to be clear, this isn't like flipping a switch where you instantaneously light up the good and turn off the bad. It takes practice. It takes repeated practice, but it's possible. And that's what's most important. So one of the very first studies they did is with London taxi drivers. This is a map of the 25,000 streets of London. And to become a London cabbie, you had to go through 4 years of training. Just like in America, we go through 4 years of medical school. So they had to go through 4 years of schooling to become London cabbies. And they had to learn how to navigate these 25,000 streets. And what they saw is that over the course of this practice, the visual spatial mapping part of their brain got bigger and stronger. So this is called cortical thickening. It's the growth of new neurons in response to repeated practice. Sound familiar? What you practice grows stronger. That monk in Thailand 25 years ago knew exactly what he was talking about. Okay. So what this means, as I said, is that all of us have the capacity to change. Not just some of us, not just when we're young, but throughout our entire developmental arc, throughout our entire lifespan, we have the capacity to change. They have seen new neuronal growth in people in their 9th decade of living. Okay, so all of us in any moment have the capacity to change. And one of the things that I was most interested in and want to share with you is this capacity to change our level of happiness. So I would say most people's goal in life is to be happy. I think most of us go about it in the wrong way, but I think happiness is a beautiful goal to pursue. In fact, the Dalai Lama says it's one of the most wholesome goals of all the goals for human beings. The unfortunate part is that most of us go about it in the wrong way. So there's something in psychology called the happiness set point. And this is based on decades of research replicated again and again that shows basically by about age 7, you have this happiness set point, and it doesn't really change throughout your entire life. So if you win the lottery or you're paralyzed in a terrible accident, within 1 year later, you go back to your baseline. Now that's quite shocking, right? You think you win the lottery, you have this huge level of happiness, but 1 year later, you're back to baseline. Same is true as if you get in an accident. You decrease significantly in happiness, but 1 year later, you also are back to your baseline of happiness. So this is great news if you're born happy. You can just tune out right now. You're born happy, you're done. But for those of us that weren't born happy, which for me as a clinical psychologist is the majority of my patients, this isn't great, because then it's like, well, wait, even if I win the lottery or have these successes or marry the perfect person or I get the new Tesla, it's not going to change my happiness level. What is so hopeful about this new research in neuroplasticity is what we're discovering is that even though external changes, winning the lottery, won't shift our happiness, internal changes can. When I say internal changes, I mean carving out new pathways in our brain. As Richie Davidson says, happiness can be trained because the very structure of our brain can be modified. That's very hopeful news. And what I like to say is that anything can be trained because the very structure of our brain can be modified. Our happiness levels, our patience, our memory, our creativity, our empathy, our compassion. This is a research study done by Dr. Sarah Lazar at Harvard. And what they did is did fMRIs of people who had been practicing mindfulness for a significant amount of time. And what they found is that the areas of the brain that were responsible for empathy, compassion, learning, memory, happiness, grew bigger and stronger. And what I thought was most interesting is they found that mindfulness practice not only deactivates the centers of the brain responsible for emotional reactivity, it also helps us engage the rational and compassionate part of our brain. So again, if you think back to the officer in the grocery store, that through his training of only a few weeks, he was able to kind of short circuit the automatic knee-jerk reaction of anger, to pause and to choose his response. So what this means is that all of us can learn practices to rewire our brain and grow our resources, our resilience. Again, what you practice grows stronger. And so the most important question is, what do you want to grow? And so I want you to guide you through another practice. I want you to let your eyes close. And just taking a moment to reflect on one area of your life that could use some support, some change. So maybe it's around the theme of burnout, and that's a wonderful one to work on. Maybe it's around health or exercise or nutrition. Maybe it's being more present with your kids. That's definitely mine right now. So whatever it is for you, finding it. And then here's the most important part. Instead of kind of starting to judge yourself or be like, oh yeah, that's really a bad part of my life, or I'm not good at that. Instead of that, I want you to imagine that your dear friend, someone who you just love, easy to love. So call that person to mind, whoever they are. Imagine that they had a very similar issue as you, that's what they wanted to change. And I want you to imagine, what would you say to them? Would you say, "Ah, forget it, you're not good at it"? Or would you say, "Oh, sweetheart, I see this is important to you, and like, I'm on your team"? I want you to imagine being on your own team. I know that's kind of radical, but why wouldn't we be on our own team? So holding in mind this thing that you want to change or grow, and then really feel that you're cheering for yourself, you're rooting for yourself, you're on your own team. For me, at least, that's a very, very different feeling. And so feeling your breath, feeling your own support, just setting your intention. What's one small step in that direction? Letting your attention rest here with this attitude of kindness and curiosity. And then sometimes for me, I feel stuck, or I don't know what the first step is, or I feel a little lost. And so I'm going to offer you this very brief practice that for me is always incredibly helpful. So imagine you're resting here with this kind of issue or challenge or problem that you are wanting to heal or grow or change. And imagine that a wise person, this could be your wisest self, this could be someone that you've worked with, a therapist or teacher, a rabbi or priest. It could be a fictional character. I'm always surprised at who comes. So be open and creative, and whoever shows up, that's who's meant to support you. And I just want you to kind of invite this person close in. So they're sitting near you, maybe their arms around you, whatever feels comfortable and right. And you kind of share with them the issue you're working on, what you want to grow and what you work on. And they listen and they really understand. And then they lean down and they whisper some words of wisdom in your ear, some words of guidance. I want you to really listen. Listen for what they have to say. Feeling your breath, see if you can soften the body 5% more. taking in what they've said. And then in a moment, you thank them. They leave on their way, and you're left with this support, this wisdom. As you're ready, you can slowly open your eyes. And if you have pen and paper around you, I would invite you to write it down. We're 40% more likely to remember things if we write them down. So good. Okay, so I'm going to take a moment now to answer some questions because I want to leave just a couple minutes for one last practice at the very, very end. So if you've had any questions or you have any comments about this last practice or any of the other ones, feel free to go ahead and write them in the Q&A or in the chat box. Either one is fine. And I believe Roxanne or Erin are going to facilitate the Q&A we'll take about, let's say, 5 or 10 minutes to do that.
Wonderful, Shauna. Thank you so much. I feel very relaxed right now. I do have a question here from Dr. Clifford Wang. Is there a threshold of how much practice one develops before seeing the pathways become more long-lasting?
Yeah, thank you. That's a great question. And I'm sorry I had to put a lozenge and I have a little bit of a scratchy throat. So basically, I mean, this is the question that everyone asks is how much do you have to practice, right? To start seeing the benefits. And what the research shows is about 7 to 12 minutes is kind of a threshold effect. So we start seeing changes in immune function and sleep patterning and depression, anxiety at about 7 to 12 minutes a day in even as little as 2 to 4 weeks. The other question that comes up a lot is like, when should I practice? And truthfully, I used to say, whenever you can fit it into your schedule. But what recent research from UC San Francisco shows is that our mood in the morning and our mood in the evening is incredibly predictive of our health. It predicts the length of our telomeres, the health of our mitochondria. And so what that suggests is that the morning and evening times are important times for practice. And so I typically now recommend that people practice either in the morning or evening or both. So hopefully that gave you more than you asked for. Any other questions?
I actually have one question, Dr. Shapiro. Why is it so hard for us to have self-compassion and to basically have compassion for ourselves? You're showing so much data that shows that actually could preserve us. And I always think evolutionarily, we would want to do what helps us and preserves us. Why is this so hard? Particularly, we know for physicians.
Right. Yeah, I think especially for physicians or those of us who have maybe excelled because we've pushed ourselves. And so on one level, our own personal data is like, yeah, but it works to beat yourself up and push harder. And so I think part of the reason it's hard to do self-compassion is because we don't really trust it. We're like, ooh, that feels like I'm letting go of control. I'm going to get soft. I'm going to lose my edge and I'm going to become a couch potato. And so I don't know why evolutionarily this happened. I think it's similar to everything. I mean, the underlying causes of anxiety and depression, right? So anxiety is worry about the future and depression is rumination about the past. It's just our thinking has gone a little bit awry. It's all on a continuum. So it's not that thinking is bad. It's just it can get out of hand. It's just like dopamine is one of the, most important pathways of addiction. It's also really important in motivation. So again, everything I see things as more on a continuum. And I'd say what happens is that our tendency to kind of push gets confused. And I think our culture has not been incredibly helpful around that. We tend to push harder, stronger. We have this ethos of beat yourself up. And for me, the research has been what's really allowed me to soften into self-compassion. That I don't think if there wasn't the research, I could have done it. But looking at study upon study, they do a study with weight loss and they have one group trying to lose weight by eating healthy, whose also given compassion instructions. And they had the other group just given the basic health instructions. And the self-compassion group does significantly better. Well, that's impressive. Then you do it with exercise. Then they show that soldiers coming back from war who practice self-compassion don't have symptoms of post-traumatic stress disorder. And all of a sudden you're like, wow, this is actually a strength, not a weakness. And this is a powerful tool. But for me, and in my book, I mean, I spent 2 chapters kind of explaining the science of self-compassion because I get so much resistance when I try to teach it. So yeah, it's a great question. And I don't have all the answers to it, but all I know from my personal, my clinical experience and my research is that it works.
And it takes practice, as you're saying.
Yes. And it takes so much practice. I will tell you, it's one of the most kind of, for me, like interesting practices, because I'll do my, a lot of my practice of good morning, I love you, where each morning I'll put my hand on my heart and just say, good morning, I love you, Shauna. And when I started doing that, I just thought it was the hokiest, stupid practice I'd ever done. And luckily I really trusted my meditation teacher. But it took months and months. And it wasn't until finally, I remember I was doing the practice and I had this image of my grandmother come to me. And my Nana was like, she was my person. She raised me and she had died a few months before. So it was this really powerful, like, image of her. And all of a sudden I felt her love. And I just said, good morning, I love you, Shauna. And it was like the dam around my heart burst and this love came pouring in. But it was certainly not on my first try. And I'll tell you, it is not every day after. There are some days where it feels beautiful and kind and loving, and some days where it doesn't. But what's interesting is this happened the other day. I was carrying something like a chair, and I dropped it on my foot. And instead of being like, you stupid, whatever, I was like, oh, sweetheart, ouch, that hurt. And I was like, oh my God, I was just so nice to myself, like this stuff really works. So, it's small changes over time. Yeah.
And I like how you describe just it can be pervasive in your life in other ways. And thank you for bringing up your book. All participants will get a copy of your book, and you just came out with a workbook to that book, Good Morning, I Love You, and that allows for the practice and bringing it to everyday life. I do see one other question here. How can you reconcile or leverage mindfulness in work that involves multitasking or interruptions?
Okay, so this is a big one. So I wish I could say that multitasking was efficient, effective, and good for you, because we all do it, but it's not. What the research shows is that multitasking, it takes twice as long, you make 3 times as many mistakes, and you release cortisol into your body, which is unhealthy. So there's literally no reason to multitask, and the brain is actually not equipped to do it. So what we actually are doing when we multitask is we're shifting attentional focus very quickly, and we're kind of spotlighting from one place to another, and it has a cost, and it's only like a millisecond each time, but over time there's significant costs. So what I recommend to people is, if you read the research and you believe it, is to really make the intention do one thing at a time. And I know we can't always do that, and I'm not suggesting we do. I mean, sometimes I'm talking on the phone and I'm eating, or I'm reading and I'm eating, or we're doing 2 different things, but I'm intentional about it. And I have to say, it was funny, I was working on a chapter on multitasking some years ago. And I vividly remember I had my cell phone here, I had like my sandwich here. I was reading this article on multitasking, but I was also like, my emails were popping up. And I'm sitting there reading it, and it's like, takes twice as long, 3 times as many mistakes, and you release cortisol and get fatigued and like fat around your belly or something. I was like, whoa, and I like threw my phone away and I pushed the sandwich off, and I like closed down my email, and I was like, okay, all I'm doing right now is working on this one chapter. So I think, it's a shift that is counterculture, but it's important. Yeah.
I have one more question, Dr. Shapiro. Have you taught kids mindfulness?
Yeah, so great question. So I work only with adults. However, many of my colleagues have worked with children. One of the, I think, best programs is at UCLA. Dr. Susan Kaiser Greenland is an incredible resource. I highly recommend checking out their program. Dan Siegel, who wrote the foreword to my book and is also a very dear colleague, works a lot with teenagers and has written a number of really excellent books on kind of the children's brain and teenage brains. And truthfully, if like I had to do it all over again, I probably would have specialized in children, because, you know, even though neuroplasticity occurs throughout our life, age 0 to 25, you're on fire, right? It's you're passively being imprinted with so much information. And if we could teach our children just the ability to regulate their emotions, just the ability to pause and regulate their nervous system so that they didn't react, so that there was less impulse, reactivity, it would have such a profound effect in our world. So for those of you that are interested in teaching children or working with children, there's lots of resources, and I think it's one of the most important things we can do.
As a developmental behavioral pediatrician, this is music to my ears.
Yay, yes, absolutely. And I'll say it doesn't have to come in the form of mindfulness or meditation. I mean, social emotional intelligence, there's lots of different ways. And that's why I'm starting to use the words mental fitness, because it just is a little less jarring for people. Yeah, great. So do we get all the questions answered? Wonderful. So let me just, okay, great. So I just want to take one more moment, do one last practice with you, and then I'll let you go right on time, I promise. But what the research shows is we remember the peak and the end of an experience. Those are important. So at the end of any lecture that I give or any presentation at the university, I always invite people just to kind of reflect for a moment on everything we've talked about and everything you've experienced, and kind of find your one key takeaway. What's that one most important thing that you really want to take with you? And so take a moment and kind of think about it. And once you find it, it could be what you practice grows stronger, or it could be that shame shuts down the learning centers of the brain, or that kindness turns them on, or the power of intention, that our intentions are neurochemical and release dopamine. So whatever it is for you, I want you to find one. And then I just want you to go ahead and write it in the chat section. So you just take one more moment and write in the chat section kind of what your key takeaway was. And as I said before, when you write something down, it is 40% more likely that you'll remember it. So it's helpful, but it's also helpful for other people to see kind of what resonated. So thank you so much, Vienna. So shame shuts down the learning. That's really, really important. What you practice grows stronger. That's obviously my favorite one. Approach an experience or moment with an intention. Beautiful, beautiful. Don't shame yourself. What you practice grows stronger. Identify my intention. Yeah, it's so important to learn how to identify your intentions, right? To start every single day asking, what is my intention? These are beautiful. To make time to start the day to meditate. And I will say that one is so important for me. I can tell if I don't meditate in the morning, the rest of my day has a different trajectory. So if I can take that short period of time in the morning, it kind of pays for itself. Yes. May this time be of benefit. Beautiful. I say that for every lecture, and it's so grounding for me, just so that I don't go on automatic pilot. These are lovely. Multitasking is not as helpful as we've thought. Yes, pause and take a deep breath, be intentional. These are beautiful. So I want to take one last moment and just offer my gratitude to you. I really believe that we're never just practicing for ourselves, that everything we do ripples out into this world. So I want to thank you for making time in your life, which I'm sure is very full, to engage in these practices. And I really, my hope and my prayer and my aspiration is that they're of benefit and that they ripple out into all the people that you work with. So thank you all so much for your kind attention. I have my website here. I always respond within 24 hours to any email. So if you have follow-up questions or you're reading the book and you want to know something, please send me a note. Yeah, thank you.
Dr. Shapiro, what's the best way for people to get in touch with you? Through the website?
So this website right here, there's a little portal. It goes right into my email. It's perfect. Yeah.
Thank you. Thank you so much. This was so inspiring. I mean, the practical tools that you brought to us. I'm just in an incredible state right now. You have this amazing magnetism and power to do that. Thank you so much.
Thank you.
Just
Well,
my granddaughters, thank you.
oh, fabulous.
I also just got a text message from a dear friend and colleague of mine who is using your workbook, and it has brought so much help for her just to put these concepts into practice. So
Yeah, I'm so glad. You know, I wrote the workbook because I was getting so many messages from people who read the book and they said, now what? And I realized what you practice grows stronger. Like you actually need to do the practices to change your brain. So go out and practice. Thank you all so much.
thank you so much, Dr. Shapiro.
And everybody have a wonderful evening unless you have another idea about it.
Just want to remind everyone, this is our last gathering for the year until September. And we do have an in-person gathering June 28th, as Dr. Calloway mentioned, through the association. You can find out more information on the website for that. And I attended an amazing retreat called Honoring Diastole at Pie Ranch that Dr. Gail Wright, who's part of our committee, is hosting with Dr. Jesse Mahoney. So check that out as well. Thank you, everyone, for joining us. It was an incredible hour. Thank you, Dr.
Wonderful.
Shapiro.
Thank you.
Thank you.
Bye. Aw, thank you.